I'm Ann Noseworthy. I am coordinator of the Licensed Practical Nurse program in Northern Lakes College, and I have with me tonight Rhonda Hersack, who is the chair of our program. We make up 2 nurses of the faculty. We have, between us all in the nursing faculty, about 240 years of nursing experience. So we certainly are well versed in the trade. So this is where we would love to see you if nursing is in your future as a graduate of Northern Lakes College. There's so much pride and accomplishment to watch you receive your cap and your pin and to see you walk across that stage. It's a proud moment for us. It's a proud moment for our students and their families because they work side by side with you as you attain your goals. Practical Nurse program is a very multifaceted role. She's an educator. She teaches her clients and her families every day. She collaborates with a team. She researches. The research role in practical nursing is taking off. You're, of course, a caregiver full of compassion. Your managers, practical nurse, are educators. We've just had one of our alumni join us. She was actually in one of the first classes that I delivered here at Northern Lakes College 16 years ago. So, that the role and the place that you can go in the practical nurse profession is very vast right now. I read the mission statement and the vision statement just a bit ago. As I said, our mission statement goal is to provide health education based on best practice. Best practice means that everybody has tried the things in the past, and this is the best practice that we find in nursing, and lots of our professions are built on that standard. We want to graduate safe, caring, and competent professionals. Our vision goes a little further because we want to be the first choice health educator to meet the needs of the health system and the workforce. So we're aiming high, but that's where we want to go for sure. So if you're looking for a challenging and rewarding career in healthcare, then this program is for you. It prepares you to become a licensed, competent, safe worker, enabling you to become a vital part, I might add, of a healthcare team. Practical nursing is self-regulated, and what that means is that you have to be, after you graduate from our program, you are responsible for your competencies, and you are self-regulated, meaning you are in control, you're in the driver's seat of where you go with your competencies, and you will actually be required to fulfill so many competencies a year within your profile. The PN program has a unique body of knowledge. We encompass standards of practice with a code of ethics. As with any profession covered under the Health Professions Act in Canada, you have to have a code of ethics. We have a contract with society to provide safe, quality, and holistic patient care and client care. There's a wishy-washy, do we call them patients or do we call them clients? That don't matter as long as you treat them with care. We're fine with either. So the program itself is delivered in a blended learning method. We do have distance learning. Most of our theory is actually delivered in an atmosphere such like this. This is collaborate, and it is a classroom link. And we actually attend most of your classes this way. But we do have a blended method in the fact that we have face-to-face lab components throughout the program. What this does by having the face-to-face component and the distance learning is that it allows you, for the most part, to stay at home and while you do your learning, to stay with your family, to not have to move away from home to attain the education that you want. Most of the time we try to, and we've seen it for many, many years, is the people who train in their hometowns stay in their hometowns and enrich the environment and the living in their own communities. It's actually and with COVID this last 2 years, everybody jumped on the same bandwagon that Northern Lakes College has been doing for the last 30. So, we're happy with where we've come from. in this college. The prerequisites to join the Practical Nurse program, they're on the website as well. Anytime you go into Northern Lakes College website and you can click on programs and go to Practical Nurse, and this is all listed for you. But I thought I would mention them here for you as well. Bio 30 is necessary with a 60% in that, or you can have an Anatomy and Physiology course, Anatomy 1000 already with a 60. If you do not, we do offer a college and career prep program here at Northern Lakes College, which encompasses AMPY 0190, English 0190, and Math 0190. So if there's either one of those three components of bio, English, or Math that you are short on or you are missing, you can do this college and career prep course in the spring and bring yourself up to equivalency and meet the prerequisites of the program. If there's an area that you want to enhance as well, we do have academic upgrading that we can link you to, and we do have university studies that we can link you to. Our program is quite comprehensively designed. We start off with a very simple format, and it goes to complex. So you can expect in your first year to deal with the normal aspects of the adult client. We won't take it farther than the adult client, and we will actually, in our clinical experience, care for an adult client in their home environment in a long-term care facility. We do have 5 weeks there of long-term care learning at the end of your first year. We have nursing faculty, so we have nurses teaching nurses your nursing theory courses. And I believe that every nurse will bring something to you with her own experiences and her own knowledge. The content is designed so that the practical nurse basic competencies are met. When you graduate from the program, you will have met the requirements put forth by the CLPNA and ESAC, which is the Educational Standards Advisory Council. And they oversee to make sure they give us our accreditation to make sure our program is what it should be for you. We just don't sit down and write a program. We have to follow the rules as well. To break down the program for you, we do have 5 university studies courses that come with our program, and I'll break them down for you a little further. But in the first semester, we deal with just you. We deal with self. So we learn a little bit about how to communicate, anatomy and physiology, health education. You really give yourself a really good assessment in that course. It's an excellent course. I taught it for years. And then we introduce you to nursing and the care theories and the practice theories and where we came from as nurses in Canada. Okay. Second term, we introduce you to the client. And this is where you learn to assess and to do health histories, physical assessments, and to do your basic nursing care. And that is all wrapped around your sciences of pathophysiology and pharmacology. And you also, as I said, have a 5-week continuing care practicum there. Second year is a bit busier. We give you a more complex client. We deal with more than just the client, because now we're going into medical surgical nursing, pediatrics and maternity, where we're dealing with the client and their family. And so that is taking it a little bit broader. You do a 4-week instructoral-led acute care practicum there. Semester 4 is again a little different because we deal with the client, their family, and the community. So you can expect to learn some community nursing and mental health nursing, and we know how prevalent that is in these times. And we do a course called Transition to Graduation, which actually prepares you for the workforce and helps you get your license and everything like that. You have 2 clinical components in this term, which is, again, one acute care, instructoral-led, in either a surgical or medical setting. And then we do your focus practicum, which is 6 weeks or 240 hours, and that is preceptor-led. So that means that you work on a unit side by side with a preceptor, and the goal of that is to actually assume her responsibilities before you leave that unit. Okay? before you're finished those 240 hours. Here's a cost breakdown for you. I've just put it here in first year, and I have second year here as well. And if any of you want a copy of this PowerPoint, you can certainly give me a shout. I'll put my email here in the chat. I as well, you can go to our website and just search PN, and this will pop up. This is there for you. So anything that you need to get that for sure is there, okay? So within our program, we work on what's called a conceptual framework. And sometimes it might make a little bit of sense to have a plan and you know, a method to follow things. We have 4 major components of this framework, and that is yourselves as a practical nurse, your client, the environment that they live, that they interact, and their health, whether it be stable or unstable, whether it's a mental health need or a physical health need. And then we encompass that with other factors. And we do introduce this big time to you in your first Nursing Foundations course. And this helps you actually learn to assess your clients all the time. So the college and career prep, as I mentioned to you, usually is introduced and offered in the spring term. So many of our applicants will be what we call pending marks from this college and career prep program, if that's what's needed. If you have so many of the prerequisites but only need one, you can just take one course. So please reach out to myself or Rhonda or our admissions department, and we can try to answer as many questions for you as we can. My email is noseworthyA@northernlakescollege.ca. I'm just typing it in here for you. And feel free to please email me anytime, okay? This session is being recorded, and this will be on the web page under the virtual open house, okay, after we're done with this as well. So any questions, please do not hesitate to reach out to us. So these requirements gain you entry into the program. They also gain you entry into other programs as well. If there's any area that you feel you're a little weak on, then you know you can refresh these subjects to prepare yourself for the academic and the scholarly writing of the college level student. Within your program, I mentioned before, we had 5 university studies courses. These courses will be instructed to you by either a university studies instructor or professor. Some of the courses are synchronous, meaning that they are delivered live online, just like the session you're attending here. Some other courses, like health education, are asynchronous. And you do have a professor that guides you through the program. You have D2L, which is a learning management system that accompanies every one of our courses. But you don't have to attend class here. So if you want to do your classwork at 10 o'clock at night, that's your choice. And this is works quite well for people with children. After the kids go to bed, we do our own homework. So synchronous courses are not mandatory. We can't make you go, but I'm going to tell you they're highly recommended, because that gives you an opportunity to bridge any questions that you may have with your instructor, to listen to any tips that they have, to say, you don't know how many of my students said, Anne, when I was writing my exam, I could hear you speaking in my head. Because we say things so many times and we stress the importance of certain topics and content. And you can't get that by just listening to the recording. You can't ask the questions to get that information. So attending the classes are very important. Here are the university studies courses within the Practical Nurse program. In the fall of your first year, you do communications. You do health ed, which is health education, and English. In the winter term, we do psych, and in year 2, we do sociology, 2750, which is the sociology of aging. And we found with the demographics of the population, with people living longer, that this was more suited to what you would be dealing with in the actual clinical setting. Many students who wish to lessen their load actually take some of these courses in advance. All right, so to graduate from our program, you actually have to maintain a grade point average of 2.0. And that puts you at around a 70, okay, 68, 70. A failure to get that 2.0 would jeopardize your eligibility to graduate. So, and as coordinator of the program, don't be surprised if you hear from me and I want to work with you to find something, a program or some study tips that help you to buff up that mark, okay? In the orientation to this program, you will receive what we call a student handbook, and that's like your Bible, and we go over it in quite detail when you do come into the program. So nothing is left to your wonderment. We do try to answer all your questions for you. We have been at a very controversial and trying time over the last 2 years, working within the confines of COVID and this pandemic. We, as we know, the QR code has lifted, but I will add, because it was a question posed to me, we are still following AHS standards within our clinical. So any of our students going to an AHS facility, and I think any nursing home in Alberta, still need to have vaccines now, but we know that things are changing. And so I just wanted to put that out there for you guys if you had questions that you needed answered around that.